Hi, I'm Sophie, nurse practitioner at Turner Medical Arts. These short episodes are all about real women's health and my clinical experience and knowledge. This is a channel where I talk about all things hormones, perimenopause, sexual wellness, birth control, weight support, and everything explained simply without the confusion. Let's dive in. Hi, it's Sophie, nurse practitioner, and today we're going to talk about one of my personal favorite subjects, which is STIs. So this is a screening I always push for, honestly, all of my patients, especially those of childbearing age. So these are my younger females, and I want to read off a couple statistics that people might not know about. So these are the most up-to-date medical stats, and this is specifically for the US. So for chlamydia, 70% of urogenital infections in women and more than 80% in men are asymptomatic. So that means these people have no symptoms at all. And for gonorrhea, about 86 to 92 of urogenital infections among women are asymptomatic. So if that doesn't speak for itself, it goes to show that not feeling symptoms at all really aren't enough. The huge thing about this really is that it's not just that you might infect other people and not know about it. A huge thing that people miss is really that this can affect fertility. So another thing I want to talk about, other than just the importance of screening, which people should be doing at least once a year and between and before and after new sexual partners. So anytime you have a new sexual partner, it's a really good idea to get tested, because not having any symptoms doesn't mean you're not carrying around anything. The thing I want to talk about for these untreated and undiagnosed infections is something called PID. PID is pelvic inflammatory disease. So this is when there is some form of infection that has caused an inflammation of the pelvic organs in a female. And this can oftentimes happen from sexually transmitted infections. What this means is that these patients can get scarring in the ovaries and the tubes, and that can really cause scarring to the extent that this could cause infertility later on. So for that reason alone, it's such an important thing to do, is to be careful, wear condoms, but also get tested frequently. Something that I really try to do in my practice is to do site-based testing. Another thing that people don't really know about is that this kind of bacteria, these STIs, they can live in different parts of the body. So just doing a urine test sometimes isn't enough. It happens often, and I see this a lot, that I do site-based testing. Patients can do a self-rectal swab if they're ever having anal sex. I can do a throat swab, and we do a urine. And sometimes the urine comes back negative, and one of the other two comes back positive. And that means that even though the urine was negative, they still have that STI that they could be infecting other people with. So because of that, it's really important to do thorough testing. It shouldn't be scary. It should just be routine. And yeah, it's something that everyone should really know about, because unfortunately, most people don't have symptoms, so they don't know when to get tested. So it's a good idea to just do it regularly.